Hi, I'm Dr. Isaac Alexis from the Slim Samurai Media Group 84, helping you to slash through sickness and offering you a slice of health and wellness. Today is going to be part 2 of hypertension, barriers to treatment commonly found and faced by African Americans, part 2. We're going to discuss hypertension. It's very critical. Some 1.2 billion people affected globally, of which 45% prevalence in the African American community, and the number one source of preventable strokes, congestive heart failure, heart attacks, kidney failure, and other cardiac complications. Before I continue, don't forget to click on the subscribe, like, comment, send it 25 of your friends. Click on the notification bell as well under the subscribe button. This way you can receive fresh updates of health and wellness, which goes all out to my Slim Samurai and Samurette family. Okay, let's look at, for a brief moment, definition of hypertension. This definition is taken from the Joint National Committee on Prevention, Detection, Evaluation, and Treatment of High Blood Pressure, known as the JNC7 reports. According to these standards, and there have been several modifications throughout the years, but according to these standards, systolic greater than 140 millimeters of mercury, that top number that you see at the doctor's office, and a diastolic number of greater than or equal to 90, the bottom number of blood pressure readings. This is the definition of hypertension. Throughout the years, they've been modifying this, of course, to now bring it down to 130 over 80, and anything above that traditionally is defined as elevated blood pressure leading to hypertension. And I let my patients pretty much aim for a blood pressure of 120 over 80, taking all factors into consideration coming to my office. If blood pressure is 130 over 80, I've been following them for a year, and I know that they traditionally are 120 over 70. I don't have a problem with that. Lots of times being cut off in traffic, waiting at a long traffic light, road crews, construction. The patient is feeling that they may be late to their doctor's visit, so they're a little stressed. There's a release of catecholamines. There's an adrenaline rush. All those factors is going to give the patient elevated blood pressure, elevated pulse, so not to worry. Main thing is that they are eating fresh fruits and vegetables. In particular, they should be having in any given plate, 70% of that volume of the plate should be fresh salad, fresh fruit. So I like to see some blueberries. I like to see some strawberries on that plate. I like to see some red seedless grapes, kiwi, cucumbers, tomatoes, spinach, and a plum, a pear. For protein, I would do grass-fed poultry. That could be a grilled 6-ounce chicken breast. That could be a 6-ounce slab of organic wild salmon, organic wild mackerel, red fleshy seafood. That's going to be your best bet. Loading up on those omega-3 anti-inflammatories, keeping the ratios of omega-3 to the omega-6 fatty acids in your diet at an optimum level, decreasing inflammation and decreasing any risk of irritation to the coronary arteries and the vasculature, which can lead to elevations in blood pressure. Now, get back to the JNC7 criteria of hypertension. We discussed that 140/90, anything greater than or equal to that. Now, we're going to look at a table. I'm going to include that. It's going to flash on the screen in my next video. And so this table comes from the CDC, the Centers of Disease Control. And in it, a comparison in percentage of African American, white, Mexican American men, and African American women with elevated blood pressure was conducted by the CDC. Now, this is what they are reporting, and I want you, my Slim Samurai and Samurai family, to always be well educated and well informed. Now, the data is from 3 time periods, from 1988 to 1994, then 1999 to 2002, and then from 2003 to 2006. In all 3 time periods, a larger percentage of African American men had elevated blood pressure than did white or Mexican American men. But compared with the 1988 through 1994 time period, the percentage of men in each race or ethnicity group with elevated blood pressure had decreased by the time we reached out further to the 2003 to the 2006 time period. The percentage of African American women with elevated blood pressure fluctuated also over the 3 time periods, but by the 2003 to 2006 time period, the percentage of African American women with elevated blood pressure was lower than the percentage of African American men who still had elevated blood pressure. Now, there are 3 factors that can lead to decrease in death rates in black men when it comes to high blood pressure. And this applies to, of course, all races, all ethnicities. But the reason I'm focusing specifically on African American males is because in this study, the CDC is focusing specifically on African American men, as even at the federal government level, they recognize that our blood pressure as African American men traditionally still lags behind other groups when it comes to getting us at the optimized blood pressure, which will be at goal in reduction of cerebrovascular disease, cardiovascular disease, namely heart attacks, strokes, heart failure, pulmonary hypertension, pulmonary edema, kidney failure, and other health factors related to uncontrolled high blood pressure. So it's a very critical factor that the government is now recognizing in further detail. Now, the 3 factors that can lead to decreased death rates in black men with high blood pressure is number 1, awareness. If you're not aware, then how can it be treated? Number 2 is obviously treatment once you are aware. Number 3, control. Now let's look into it a little more in detail. What is awareness? Based on the CDC guidelines, in this survey, awareness is being told by your physician that you have hypertension. Now, number 2, what's treatment? Treatment is taking medication as prescribed once the diagnosis of hypertension has been made. That brings me to number 3. Now, what is control? Very important. Control is maintaining blood pressure within the normal limits, not just once, not just twice, not just 3 times, but rather over a long time period, meaning over years. Now that we have clarified those definitions, still During the 1999 through 2004 period, while more than half of African American men were aware that they had high blood pressure, 56% were receiving medications, and only 30% had their blood pressure under control. So we really have a long way to go. We want to get those numbers up to at least 90%. The percentage of African American men who were aware their hypertension was similar to white men. It was larger than that of Mexican American men, but still smaller than that of white men and African American women. These trends were consistent from the charts of what we had traditionally seen during the time periods ranging from 1988 through 1994, and also from 1999 through 2004. So we still, in 2021, still have a long ways to go in getting tighter control, decreasing the morbidity and mortality from hypertension, strokes, heart failure, pulmonary hypertension, pulmonary edema, kidney failure, from uncontrolled hypertension, also known as high blood pressure. Now, interestingly enough, a significant predictor of greater, number one, awareness, number two, treatment, and number three, control of cardiovascular disease is, therefore, increasing age. As African American males increase in age, those three factors increased, thereby causing more awareness with the subsequent treatment, and then the goal of controlled long-term high blood pressure, which obviously is going to decrease long-term risks of heart failure, strokes, heart attacks, and kidney failure. As always, my Slim Samurai family and Samurettes, I'm here to educate and to inform, of course, never to judge, and only to help you, my Samurais and my Samurettes, live to 100 years of age. This message is for all of my Samurais and Samurettes from all the colors of the rainbow: black, white, brown, red, green. They are all precious in the eyes of God's sight. I'm Dr. Isaac Alexis from the Slim Samurai Media Group 84, helping you to slash through sickness and offering you a slice of health and wellness. God bless.